Mask or no mask, the kids head back to school. Joining us on Columbus on the Record this week, Joe Ingles, State House reporter for Ohio Public Radio, Bob Clegg, Republican strategist, and Morgan Harper, progressive activist. We thought the start of the school year this year would be fairly straightforward, controversy-free, but no such luck. Kids in some Central Ohio school districts return to class next week as the Delta variant has COVID spreading across the state. The CDC now classifies nearly all of Ohio as having a high level of COVID transmission. Those are the counties in red. Franklin County and every other Central Ohio county is red. And with the rise in cases comes an increase in hospitalizations.
Now, while we have substantial hospital and ventilator capacity remaining here in Ohio, we nevertheless have heightened concern as reports emerge from other states that hospitals there are beginning to turn away elective procedures and face real pressure on their physical resources. We don't want to see our hospitals here in Ohio facing such a scenario.
Ohio's newly named health director says the key to fighting COVID is to get the vaccine and to wear a mask even if you are vaccinated. Joe Ingles, that's where school districts find themselves caught in the middle because kids under the age of 12 cannot get vaccinated. So should they wear a mask?
They cannot get vaccinated. And there's also the concern that people who are vaccinated can get some breakthrough. It doesn't happen so that people get, breakthrough is when you already are vaccinated and then you get COVID on top of it. Now, normally that's a light case of COVID if you've been vaccinated, but you still could possibly spread it. So someone who's in a school, a child comes to school, gets exposed to COVID, that could easily break out with a lot of different people. And I think that's a concern that a lot of school districts are looking at right now. They're trying to figure out, how do we stop that before it happens? And that's why we're seeing so many of them go to mask in the very last part of this month when they start.
But Joe Ingles, the governor has no plans, the health department has no plans to mandate vax, especially for those kids under 12 who can't get the vaccine.
Right. He says there's no appetite for it. Governor DeWine is not willing to do a mask mandate. And even if he did, Mike, the legislature has a new law in place where they could actually draw back on that. So the governor says his hands are tied on this one.
Bob Clegg, they're not really that tight because the legislature's not in session right now. They're not going to be back for another month or so. School starts this week. If he wanted to, he could start the school year with masks and for younger kids and, see if we get through this surge we're going through here.
Yeah, I think that though the governor's got it right when he says that there's no appetite right now to do any kind of a mask mandate. And I also believe that the governor thinks that probably the best ones to make the decision for children are going to be their parents. So I think he's leaving it up to the parents, which I believe is the right thing to do in this kind of a situation.
But Bob, if there is somebody with COVID and the parents aren't getting vaccinated or have COVID, they give it to their kid and then they spread it to 4 or 5 other people. Is that the right way to go about a public health emergency?
Well, there's nothing if the child's been exposed and they know it, they can pull them out of school. I don't understand what else they can do in those kind of situations where you have people that aren't going to wear a mask and aren't going to get vaccinated. That's the situation as we have today. And you can't force people to be vaccinated. There's nothing you can do that can force them. You can encourage them, what the governor's done with Vax-A-Million and other things. Which have resulted in more people getting vaccinated, but he cannot go down that road of requiring vaccinations of everyone. Plus, like you said, children under 12 which I don't understand, we're still at a point where they can't be vaccinated. Yeah. And I don't know how much longer it's going to take for the science community to come up with some kind of a vaccine for children, but I would have thought by now they would have.
Yeah, I think there are tests undergoing right now from the big companies, Moderna and Pfizer, the other companies, to see the safety and the efficacy of the vaccine on children, but as we know, it takes a while. I think they're probably being extra cautious with the kids. Morgan Harper, I mean, the appetite for masks is not there. I mean, we're hearing the Franklin County health officials, City of Columbus health director saying you should be wearing a mask when you go into the grocery store. And there are a few people wearing masks in the grocery store, but not a whole lot. It seems like a lot of folks, even if they were pro-mask early on, are not really, don't want to go back to the masks.
Well, I don't even know if folks are getting clear messages on what they should be doing. So, I mean, I think that is part of the challenge here is that we really need leadership. The governor can do what he thinks is necessary to protect public health. Businesses can say that they're going to require their employees to be vaccinated and masked up. And those are the types of consistent messages that are going to allow us to continue to stay both healthy and protect our economy. You know, I was just talking to a small business owner today who is terrified that they're not going to make it through the fall because they don't know what the health situation is going to be, and they're worried about their employees, that there aren't going to be the same benefits to get to available if they aren't able to stay open. So this is really a time more than ever when we need very clear leadership that's willing to stand up against the misinformation and make sure that we get through this Delta variant, but also over the next few months, how the virus continues to evolve and change and challenge us.
Joe Ingles, the pace of Ohioans getting the vaccine has increased somewhat over the past few weeks. What do health officials say is the reason for that increase? Is it just fear of this Delta variant?
It's increased a little bit, but let's be clear, there's not been a massive increase, okay? But it is the Delta variant that seems to be the concern of a lot of people. One thing I want to point out about kids wearing masks to school, you know, a lot of us can probably relate. When we were kids, you know, mom said, oh, you have to put a sweater on and not have bare shoulders when you go to school on a hot day. And, you know, we all put the sweater on, got out of the house and stuffed it in our backpack or whatever so that we could, you know, be comfortable at school. That's what's going to happen. I mean, in a lot of cases, a lot of kids are going to say, oh, mom and dad want me to wear the mask to school, but when I'm out of sight and I'm with my friends, I'm just going to take it off. And then if there's not a mask mandate, it's very hard for teachers, for school officials to enforce that selectively.
Bob Clegg, when the lawmakers do come back, they're going to look at bans on mandates, and one bill that's under consideration would ban private businesses, private entities from mandating their employees or even their customers be vaccinated. We saw today that a couple of concert venues in Columbus are going to mandate that their concert goers, their customers, be vaccinated. What do you think about the efforts to ban private companies from issuing these rules?
Hey, you know, Mike, I'm always been of the belief that government should not be telling business what to do. And you know what? They shouldn't be telling business what to do, even in this stuff. I think a businessman, like Morgan was just talking about, there are a lot of businessmen out there and women that are not going to survive or worried about surviving in all of this. And I think when you own your own business, you got to do what you believe is best for your business. I think most businesses like bars and restaurants, they're not going to be all that into mandating that their customers, do this or that. But I think that should be left up to the owner themselves. I don't think the government should be telling business owners what they should or shouldn't do.
Morgan, could businesses market this? I mean, I bet there are a lot of people who are going to be more comfortable going to a concert at Express Live or at the Newport because they know everyone there at least is going to have some degree of proof that they're vaccinated. They could market that. My employees, my customers are vaccinated.
Absolutely. Yeah. And to try to impede a business's ability to both market safety and health and keep their employees safe, it doesn't make any sense and really not a good use of time from the legislature. So yeah, I really agree there that we should allow businesses to navigate this and especially those that are putting health and safety first. That also is going to be best for us economically. And it really does make sense from a public health perspective to try to ensure that people who are gathering indoors are either staying fully masked, but if it's a restaurant or a concert where people, maybe it's not as straightforward to stay masked, are showing proof of vaccine or that they have recently been tested. This is straightforward. This is based on science. this is what we should all be encouraging, not seeing our government, our leaders try to impede folks from doing the responsible thing.
Okay, there are two big name Democrats, two now in the race for Ohio governor. Cincinnati Mayor John Cranley this week went from thinly veiled to official candidate for governor. He faces Dayton Mayor Nan Whaley in next year's primary. Both are running against what they call a culture of corruption at the State House, and Cranley makes some big promises.
We will create 30,000 new, good-paying jobs that pay $60,000 a year to build roads, add broadband, and a new energy economy. And when we legalize marijuana, we will use the money to pay for it. My plan also starts a $500 annual dividend from energy profits to cut poverty and to raise up the middle class.
Cranley says if he does not get all of that done in his first term, he would not run for re-election. Morgan Harper, Cranley is seen as a moderate, sort of a Bill Clinton type Democrat, but he's trying to attract progressives, legalizing marijuana, $500 stipends from energy companies. Will he appeal to progressive Democrats in Ohio?
Yeah, interesting to see him hop into the race. There's been a lot of talk about that already, and I think it's a good thing to have choices in primaries, and putting out a lot of ideas, like you're saying. I mean, it's a bold statement to put out that many promises and say if you can't finish it in a term, you're out. We'll see how that plays. I mean, it could also be interpreted as potentially a lack of commitment to see the full course through, but. No, I mean, I think they're interesting ideas that he is presenting. A lot of them are driven by, a vision of economic development for the state, which we know that there are a lot of folks in need of a new plan there, and we'll see how voters respond.
Bob Clegg, of course, you're a Republican strategist. You don't advise many Democrats, if at all. But shouldn't the Democrats be focused on moderate Democrats, independents, who right now might actually vote for Mike DeWine if the election were held today?
Well, like you said, Cranley is viewed as being a moderate Democrat, which in my world is kind of an oxymoron. So, I'm not sure. I think what this is lining up to be is what we just saw in the special election up in Cleveland and Akron, the 11th district, where you had a quote unquote more moderate or establishment Democrat running against a progressive candidate. I think Nan Whaley is viewed as more of the progressive candidate. This is a battle that the Democrat Party is going to be fighting over the next 2, 3, 4 years. We're seeing it in Washington right now in Congress over the some legislation where Democrats from more swing districts are not signing on board for some of the generous money give outs that the progressive part of the caucus want. And this is a battle that is going to take place here in Ohio. And I'm just going to sit back and watch and enjoy.
Yeah, that's the question, Joe Ingles. I mean, there's two schools of thought on a primary. One is that it spends resources that one of the candidates could use, needs in the general election. The other hand, it keeps the Democrats in the news cycle. They'll both be piling up on Mike DeWine. They already are. And they're friends, apparently. They're both mayors, Southwest Ohio.
Yeah. And, the thing with Nan Whaley is she's been out there for a while drawing distinctions between her and Governor DeWine. She has been, you remember the gun plan that Governor DeWine came out with, and he took it to the legislature and they didn't like a lot of it and they didn't do it. But, right there, she was with him on that point. And then when things fell apart and the gun plan didn't get done, then Nan Whaley came out with her own platform on guns, how she would handle it. So she's been, for the last couple of years, she's really been in the public eye, trying to draw that distinction between what she does and what Governor DeWine does. We haven't seen that so much from John Cranley. So he's a new name, and I'm sure he'll probably get out there and try to do the same in the coming months.
Morgan Harper, 4 years ago, Mike DeWine and John Husted were primary opponents in the beginning, and it turns out that John Husted deferred, took the lieutenant governor slot, deferred to Mike DeWine's seniority, probably his also electability as well. Do you see that scenario happening here, where one of these candidates would say, okay, I'll run for lieutenant governor, you run for governor, let's have a united front?
possible. I mean, still early on in terms of the race for the primary, but I do think that we as Democrats are united in wanting to be anti-corruption, though, and also trying to stop a lot of the obstructionism that's happening from the Ohio Republican Party. Both, a lot of folks here completely focus on Ohio, but also in Washington, and so totally seems like that it's possible that they will continue to work together and be united in that effort to stop this. And all of us really throughout the state of Ohio deserve more than, the cronyism and corruption that seems to have taken hold at the State House, and folks that aren't really looking to use government to support working people, small business owners across the state.
Bob Clegg, that will be the theme for the next 6 months. Nan Whaley, John Cranley, Jim Renacci, who is Governor DeWine's primary opponent as of right now, they're going to be blasting this, quote, culture of corruption. Does that give you some anxiety that it could damage your candidate, Mike DeWine, in a general election, should he make it to there?
Well, I mean, it hasn't damaged him yet. I mean, we don't even have anybody in his office that's even being questioned about any of this stuff. So I think for him to even come close to being damaged, it's got to be brought a lot more into the governor's office than it hasn't yet. So until that happens, I think he'll be fine.
Okay. We now know how many people live in Ohio, or at least we have a pretty good new estimate. The U.S. Census released its data this week. It shows Ohio has now 11.8 million people. That's a little higher than it was 10 years ago, but the state is not growing as fast as other states, and that's why we'll lose a congressional seat. Looking more closely at the data, Columbus is growing at a good clip. The city is up to nearly 900,000. Union and Delaware counties are among the fastest growing counties in the nation. Central Ohio, like the rest of the country, is becoming more diverse. Franklin County saw big increases in the population of Black, Hispanic, and Asian residents. Bob Clegg, this is a huge data dump, and it takes months, even years, to get through all this. But what does the census tell you about where we stand as Ohioans and Central Ohioans?
I don't think there was anything in this data that is all that surprising. It showed that the state grew a little bit, which we all knew. And it shows that in Ohio, the areas that are growing the most are obviously Central Ohio, and then a little more somewhat down in Southwest Ohio. The Toledo, Cleveland, Youngstown, northern sector is losing population. And we expected all of that. So I don't think there was anything going on here that was all that surprising. And, we already know we're going to lose one congressional seat, and that will shake things up on a congressional level. The main thing, though, is this data now means that we can start drawing our new lines, both for congressional purposes, but also for state legislative purposes, too.
Yep. Morgan, on the diversity issue, no real surprise that we see it all around the country. This nation is becoming more and more diverse, more African Americans, more Latino, Hispanic folks identifying as mixed race, Asian, both South Asian and East Asian folks. How do you look at the Central Ohio numbers? Were they about what you expected? Do we represent what the rest of the country is seeing?
Yeah, it seemed like, as Bob was mentioning, I mean, no surprise that there's been a lot of growth in Central Ohio and Franklin County, and it is diversifying. I mean, I think a lot of that has to do with people who are moving from other parts of the state, in addition to folks who might be coming from other states, but because of economic opportunity here. And that's where, looking long term, though, we also need to figure out a game plan for how we're going to make sure that we have folks across the state who can be employed, grow, build families, all of that. But it is important too, I would say, to note that we need to have representation that is reflecting the growing diversity among the population. And so as we're looking for elected officials and candidates, that is speaking to the populations that are existing in Central Ohio and that we need to have in our elected officials as well.
The process by which candidates pick their voters now can really get going, as Bob mentioned. Joe Ingles, the first deadline's 3 weeks away or so for state legislative districts to the first map to come out. Will the state commission meet that deadline?
I can't really hear what you asked, but I think you're talking about the deadlines here.
Yeah.
Going into this. Now that they've got the data, they've sent it off to Ohio University. They're really looking through it for redistricting purposes, and we know that there's going to be, on the legislative side, there's 10 hearings in different places throughout the state. Those will be happening in the next couple of weeks. Those are published so that people can see those. And interestingly enough, there was not one in Central Ohio, which is the fastest growing area we're seeing in the state. So maybe that's because they think, oh, it's so close to the State House or whatever. But the lawmakers are going to be looking at all this information, coming up with maps that will not be available at these hearings, by the way. And they'll be looking at the maps, coming up with those. And then on the congressional side, the legislature's starting to that process as well. But that has a little bit more time than the legislative side.
Yeah. Bob Clegg, what's your prediction? Are the Republicans going to play hardball here? They have huge majorities in the House and the Senate. My guess is they'd like to keep them, or close to keep them. But they could go for a 4-year plan and just say stiff on the Democrats and go for 4 years. Might that happen?
I don't. I think that would only happen in the if it's really pushed to that level. I don't think they want that to happen. To be honest, I don't think you have to do that. The problem we're going to have here is unless we come up with, we have 15 congressional seats. If we come up, I think Democrats might approve a congressional plan that's an 8-7 split, 8 Republicans, 7 Democrats. That may be the only thing they would approve. It just depends not only the attitude that the Republicans have going into this, but also the attitude that the Democrats have going into this. Do they really want to try to come together and agree on something, or are we just going to try to be obstructing the process and not get to any kind of agreement so that there is only a 4-year plan? We're going to have to wait and see what everybody says.
Okay, our last topic really quick. Ohioans who receive Medicaid won't have to work to receive the health care benefits. Although implementation was delayed by the pandemic, Ohio Republican lawmakers and the Trump administration issued the requirement that all new adults in Ohio on Medicaid under the age of 50 work, go to school, or take job training for a total of 20 hours a week. Supporters say the requirement would help Medicaid recipients become self-sufficient and reduce costs to the program. Opponents say the requirement would hurt the people who need the health care the most. This week, the Biden administration rescinded the federal government's approval of that requirement. Joe Ingles, it seems to me that most of the folks who are made eligible by the expansion of Medicaid are already working. Is this more symbolic than anything else? Both the requirement and the rescinding of the requirement?
Let's be clear here. I think one thing needs to be made sure up front, and that is that this has never gone into effect.
Yeah.
It was supposed to go into effect on January 1st, but then we had the pandemic, so that's pushed it off. So this requirement has never been in place. That's the first thing. But the second thing is that, yes, a lot of the people who receive Medicaid are indeed working. This would have required that. And there would have been some exceptions for childcare and some other things. But for the most part, most people we've seen have been working. This would have just made it a requirement.
Morgan Harper, is this not an incentive for folks who are not working to say, if I go to work or go to school or job training for a few hours, 20 hours a week, 80 hours a month, it would help them in the long run?
No, I mean, we need to stop making people jump through hoops to get access to basic services that we all need to be healthy and productive. And so, it's good to see President Biden taking this type of step. And we need to overall be thinking about how we can just support folks getting the resources they need to be stable, to be healthy. And that should be the goal of everyone in government.
Bob Clegg, are there any studies that prove this stuff works? The work requirements, the welfare to work we've had now for a long time. Does it actually help boost these folks long term?
Well, I think it does in that it gives the opportunity. Like Joe said, a lot of these people are already working. Okay, well, but those people that aren't working, it gives them the ability to learn skills, get more education, get more things going. That they can improve their lives. And I think President Biden just kind of cut that all out. He said, we don't need to require people to get a skill or learn a job or try to get a better, a job. If they have a job, try to get a better job by getting, become more skilled and learn more. Okay. And I think that was the best aspect of this program that is going to be lost.
All right, time now for our off the record final parting shots. Morgan Harper, you're up first.
Just going to put another plug out for all of our restaurants and folks to support that, because I mean, with the Delta variant continuing to be out there, we need folks to get vaccinated and also support our businesses so that they can make it through this uncertain time.
Great. Bob Clegg, your last thought.
For the first time ever, the U.S. Department of Labor says we have over 10 million job openings in the United States. This is a problem. We have a shortage of labor, and this is going to cause our economy all kinds of disruptions, including increased inflation because of the kind of wages that are going to have to be paid to try to get people to fill all of these positions.
Okay, Joe Ingles. Joe Ingles, you're up next.
It looks like Ohio stands to gain about $808 million from that national settlement with the opioid distributors. But now we're learning from Attorney General Dave Yost that that's kind of in jeopardy because so many different cities and entities are not buying into it. They need 95%. They've got 86 right now. So he's appealing to cities to get on board so that they can, the state can rein in and get that $808 million.
All right, a suggestion to convince Donald Trump supporters to get the vaccine. You should use his own words. Put a billboard in Southern Ohio with his picture and says, "You should get the shot." He said it at a convention in April. That's Columbus on the Record for this week. Check us out online, wosu.org/COTR. For our crew and for our panel, I'm Mike Thompson. Have a good week.